Colon cancer is an oncological disease. This means it is a malignant tumor that forms inside the abdomen, in an organ called the colon. The colon consists of two parts, the large intestine, which is located in the abdominal cavity, and the rectum, which is located in the pelvis. Colon cancer is one of the most common oncological diseases not only in the world, but also in Russia. Every year, more than 75,000 people, which is the population of a small city, are diagnosed with colon cancer. It's not just ordinary people who get sick, but also celebrities, scientists, and politicians. This disease affects many families. But what's most important, and I think you should know this, is that this disease is very treatable. Even though for many people, cancer sounds like a death sentence, colon cancer is actually a highly curable disease thanks to modern treatment methods, with surgery being the primary approach. In addition to this, treatments such as chemotherapy and, in some cases, radiation therapy are also used. Colon cancer is a tumor that forms inside the lumen of the intestine. The intestine is a tube, a hollow organ, and the tumor grows into the lumen of the intestine. It's kind of like a blockage in a pipe. There comes a point when the tumor blocks the intestinal lumen, and this leads to a condition called intestinal obstruction. This is a life-threatening condition where the wall of the intestine above the tumor becomes severely distended because stool accumulates there and can't pass through the tumor's lumen, which is blocked. This can lead to rupture of the intestinal wall, peritonitis, and death. Another life-threatening condition in colon cancer is chronic anemia and bleeding. This is because a tumor is active tissue that releases a lot of blood, and over time, people can develop severe anemia. This is one of the first symptoms in cancer of the right side, the right half of the colon. And in some patients, especially if the tumor is located in the left half of the colon, there may be bleeding from the tumor. That's when people first notice that, during a bowel movement, they pass a small amount of blood along with their stool, and sometimes even a lot of blood. This is also one of the first symptoms of colon cancer. This is also a life-threatening situation, and treatment for colon cancer is always necessary. The most important thing is that a malignant tumor is tissue whose goal is to take over the body, and it works toward this every day. The tumor can spread in different ways. First and foremost, the tumor grows as a nodule and invades the surrounding tissue. Secondly, cancer cells can spread through the lymphatic vessels and lymph nodes. And we often see this when performing diagnostic procedures such as CT and MRI scans. But the most frightening thing that can happen with various tumors, and especially with colon cancer, is the formation of distant metastases when the primary tumor develops in the intestine, but its cancer cells, carried by the bloodstream, end up in other organs. Most often, these organs are the liver and the lungs. And there, they begin to grow as separate tumor sites. And, as a result, there is much more tumor tissue in the body. This is active tumor tissue, which also releases toxins. A person constantly feels tired, has no appetite, and loses weight because the tumor draws in a lot of nutrients for itself. And if colon cancer is not treated, over time a person dies from cachexia, from a lack of nutrients, or from one of the complications I mentioned earlier.